Hello, this is Irene with SaugaTalks. Hello, hello. Hopefully everyone's doing well. And today we are here with Ed Peters, who is CEO and founder of Data Discovery Sciences. Hello, Ed. Thank you.
Hello, Irene.
Thank you. And Jim Sinur is today here. So Jim is an independent author. He's an analyst. He's a thought leader in technology. He's IT consultant. Jim, welcome back.
Thank you. You forgot troublemaker.
I forgot troublemaker, so I'm adding. I'm happy to add troublemaker, yes. So with this wonderful company today, so first of all, a couple words about SaugaTalks, because talking to our present audience and future audience, we need people to view this. It's gonna be fun. This is gonna be great. So I have my smiley guests today. We have enormous topic, I promise you. I'm gonna announce it in a second, I promise you. That's gonna be an interesting discussion. But most importantly, we do need comments and likes. As common as it sounds, we need likes, we need engagement, and we need views, and we need subscribers, okay? So pleading to all my friends, to all my colleagues, to Jim's friends, to Ed friends, we want this to grow, we want more interesting conversation, but for that, we need YouTube to promote these videos because this is valuable content, I believe, and my guests hopefully agree with me. So without any other interruption here, so here we're gonna talk about data science, we talk about models, we talk about observations that our knowledgeable guests acquired during past few weeks since we spoke last time. And it's important to kind of reconvene and understand, is the data getting better? And we will be talking about, yes, we'll be talking about pandemics and COVID-19. So is the data getting better? Are models getting better? Okay, are people getting better because we're finding more proof of such and such concepts? So we all, of course, want to see when we're gonna peak, when the better times will come. But for now, I'm giving the stage to Ed Peters. Ed, take it away.
Thank you. First of all, let's talk about models. Now, all of the comments we're seeing recently, from the White House press briefing to the even normal press, are about the models are wrong. The current models are wrong. Well, this shouldn't be surprising to anybody. And what I mean by that is there's this myth out there. I call it a mathematical, idolatry. We just look at all these models and we think that they come out of some type of computer machine learning. Oh my gosh, they're so smart, they must be right. Let's go back to the person who was one of the first mathematical modelers of note. That's Professor George Box from Northwestern. And he said, all models are wrong, but some are useful. Now, what did he mean by that? Well, first of all, there's a painting you may all know of back, from a painter named René Magritte, who was a Belgian surrealist. And the picture of a pipe. And it says in French underneath it, this is not a pipe. Well, what did he mean? Is this some kind of trick? No. What he's saying is, this is a picture of a pipe. It's not a pipe. Well, that's the same thing about any one of these mathematical models we look at. And what Professor Box was driving at, this is not reality. It's a picture of reality that we build. And it's useful when it is actually representing what we see. And now what we know is that the first model that we looked at that drove all of the initial hysteria was the model built by the Imperial College of London. And if you take a look at the data from the model and the predictions, you'll see two things. Number one, they used the Chinese data set, which we know is false. Number two, they also had a small sample size of 60 plus patients or potential patients that they sampled coming off of airplanes. And they used those two data sets to come up with a model that wildly predicted the number of deaths that would occur and from the number of infections from COVID-19. Now, right there, we have a case of the model is wrong and off by an order of magnitude because the data were wrong. So we had a bad data set filtering into a model whose results are then necessarily actionable input to making major policy decisions worldwide. Now, you take that fact, you match it with a press that wants to whip up hysteria, and what you wind up with is what we see today. And now there's a lot of backtracking on a lot of things because everybody's trying to go back and correct what I call that insight value chain. Mm-hmm. Now, how does that start? First, it starts with not the data, but a question. What question are we asking? And depending upon what question you're asking or what problem you're trying to solve, that will then back you up to what type of data do we need, and then we explore the data and we look for relationships. So if the question we're asking is, oh my gosh, how many staffed ICU beds do I need to accommodate what amounts to be a huge number of potential infections, then what you get is the model you see on TV. They're always looking at peak infections, and then we see a line going across, which is really staffed ICU beds, and then there's a curve flattening underneath it. Now, what does that mean? Well, that staffed ICU beds, like we talked about in the last session we did, is the major constraint. So the idea being, oh my gosh, we have to all go home and socially distance ourselves so that when the peak, so that when we're likely to get the infection, there's an ICU bed in a hospital to treat us. Now, is that the only way to solve the problem? Well, we're acting like it is.
Yeah, probably not. But isn't there something that we've learned from these models that the models were correct on? Number one, there will be exponential growth. We know that just by looking at the 1918 models for the Spanish flu. We can see that some cities treated it a certain way, like Philadelphia, and ended up having a parade and did not, quarantine. And they had a huge peak. And then there were other models where cities said, okay, let's stop this right now. And they ended up with 2 minor peaks. If you take a look, those models were helpful. So like you said, models are useful, but they're not going to necessarily be accurate, particularly in emergent situations where the data is not known to the level that it needs to be. I mean, models always look really, really great after we tune them with data after the fact. The problem is we're trying to predict on the front end of it. So I think the models, while they are flawed, the data is flawed, there's lessons we can learn from it. So for instance, I've been looking at the death ratios, cases to deaths, to see whether, predict when the US was going to hit their peak. And it went up from about 2.7% to now over 4%, and the world average is 5%. So I'm seeing that model's working for me to say, have we peaked or not? And of course, the Italy data is quite skewed because it's an aged population, and that 5 number is probably influenced by that. But the 5% seems to be the peak. So I'm watching in Arizona because we're kind of a laggard in many ways. New York thinks we're a culture-free zone, actually. And so we think that, it's going to move in from both coasts towards us. And I've been watching that ratio move from 1.5 to now 2.3. So I think in 2 or 3 weeks, we're going to peak. So I think the models help us and give us some lessons. That doesn't mean we throw the models out, and I don't think you're saying that, Ed. But the next time we have a pandemic, we'll probably have a better model.
We'll have a better model. Yeah, we'll have a better model. So, Ed, do you find the data improving over time? Because of course, right, different states are different lifestyle and social situations are different. I mean, is there some live feedback to the models that we're seeing in the press and everywhere now? Do you know?
Well, number one, it's hard to know. I'm assuming it's better than the Italian data, and better than of course, the Chinese data. In the Italian data, what they were finding is if you look at the number of expected deaths in any one period for the population, and then you added the expected COVID-19 deaths, you still have this outrageous number of deaths above that. So what that says is the data collection, which was all about cause of death, was wildly inaccurate, which makes it almost unusable. Now, if you go to the US, there are about 5,200 community hospitals across the US. Each one of those is a data collection point. Each of those is at the county level, which is collecting data and feeding that to some county collection point, which is then feeding it to the state and feeding it up from there. What do you think the error is among the actual proper designation of cause of death in those across those 5,200 hospitals? We don't know is the answer.
Yeah, we don't know.
And the answer is it's probably very high. But that's okay, it's the best we could get right now. And then from there, we're trying to, again, drive it into a model with one constraint. Now, the interesting thing is, if you do look at a positive thing the Chinese did, which we're starting to do now, is not only have the constraint of the hospital beds and try to flatten the curve based upon, protracting the period when you might obtain the disease until there's somebody there theoretically available to treat you, they also use hospital building as surge capacity. Now, you're starting to see that here in the US as well. Another way to solve the problem is, well, increase the number of beds. The original estimate of the number of beds was that there were going to be 160,000 beds, which we know is now incorrect by the current data that we have in the models. And there was a capacity of about 62,000. So we had half the beds we needed. So flattening the curve, social distancing isn't going to solve the problem by itself. Increasing the number of beds through surge capacity building, what the ships are doing in some cases, as well as what the Army Corps of Engineers is now doing, is the second part that's very helpful. A third piece would be to actually look at the populations of each county, because while we have the number of beds that we're short nationwide and we're projecting, that's not where this is happening. The ground truth is happening at the county levels where you live, not in some model in the sky. So it's your county, and what's the population of your county? How are the cohorts, age group cohorts? Are they, how many people are above 60? How many above 70? How many above 40? Those groups each have a different probability of contracting the disease. And then you get to the other factor, which group has comorbidity. So if you have hypertension, diabetes, heart conditions, and you contract the disease, that is more likely, you're more likely to face a mortality. But more importantly, for our discussion, you're most likely to face a need for a staffed ICU bed. And to build the model we need, we really need to take all three of those factors into consideration to get to collect the data for those and get a good view through the model of what the real probability is. That's why I think the ground truth here is widely varying from what the real necessity is. And we'll see that if we took that into consideration, we would need a much lower rate and probably only need to quarantine sections of the country, not the entire country. And that is something we probably didn't have time to get to originally, but we really need to do that next time before we shut down a $20 trillion economy.
Ed, how do you factor in, because we read the stories about 30 years olds, okay? We read the stories about very healthy people who are not in high risk part of population, and yet the story is horrifying in a way that it really spreads uncertainty because young healthy people cannot handle the disease as well. So it has something with the immune system. It has to do something when young and flourishing immune system starts fighting and it's actually losing to disease. So how do you factor in this kind of data? It's probably not right, not majority of the cases, but where is this value in those models?
Well, that's a great question. Currently, I don't believe that's factored in. For instance, the only people that are trying to factor that into the equation that I know of is the country of Sweden. The country of Sweden actually did an analysis of their population, asked their highest risk groups that are over 60 to self-quarantine. They asked people who are showing symptoms to self-quarantine, and otherwise, cafes are open, business as usual. So they're actually taking a different approach to this whole problem. Now we'll learn at the end, which one was more effective than the other. And unfortunately, we can't know that till after it's over, but we could have done some better modeling up front to be able to get a much better picture of reality than we have now, which we're, again, giving a single constraint model to our decision makers to shut down a $16 trillion economy, a $20 trillion economy.
So Ed, do you think that we're going to change the way we handle things now? Do you think more people would going through scenarios, medical scenarios for the country based on the data that we've learned? So after this is all done and dusted, do you see that hospitals will do more scenario planning? Do you see our governments doing more scenario planning? Do you see they'll dissect it and say, well, look, these states didn't want to do the social distancing and they didn't have any problems, or they did and it was for nothing? I mean, do you think that data will be sliced and diced, and will we become better at modeling and scenario planning?
Oh, evident, without a doubt. I think that this will be written about forever, will be the subject of countless PhD theses, will be the subject of countless lawsuits, no doubt, in our situation. But what I really believe is that this shows that each county, right, where the hospitals are, needs to have an understanding of its population and its needs. The one thing I really liked about the Imperial College of London and their group, they're in a group that's called Emergency Analytics. And I think that this is a very important thing that our country needs to embrace now, and should be embraced by every county in the country. And I don't know what the actual mechanism will be. I'd imagine it will be driven by some kind of federal initiative, and if not, it needs to be driven by a state initiative. Personally, I'm contacting both the governor of Texas as well as our local county judge, and it's not a law court judge, a Dallas County, a supervisor of a county in Texas is given the name county judge, but that person is responsible for emergency preparedness. So there needs to be now a collection of data in each of our counties to understand how we need to deal with this and what the issues might be, so we understand our supply chains, what we would have to do, and what we would need to be prepared for. And it probably extends beyond just COVID-19 and pandemics. For floods, for instance, hurricanes, tornadoes, all of those types of instances need this type of thinking so that we can be prepared and truly serve the population the way we should.
Yeah, and there have been some hospitals in local areas that have done that. They've come up with scenarios that they've simulated that say, what happens if we have to, basically escape the hospital, and where do we move to, and where do we move our patients in the case of a tornado, in the case of a pandemic. So some of that has been done, and what you're saying is the data needs to be localized and considered, and that's really true of any multinational, multi-state kinds of systems. You have localized rules based on what's going on the ground. I've seen that when I worked at American Express, and I saw that when I worked at Northwestern Mutual. We had different rules for different states, and what you're saying is the data has to have that, and the models have to have that. It might be silly to optimize on ICU beds in some counties versus others, because there's just not enough people that are going to get that. So, I think this is going to open the door for some better planning. And do you think business is going to learn from this, Ed? Do you think there'll be more scenario planning happening?
Oh, absolutely. I think the whole issue of supply chain and supply chain length has now come into focus for everybody. That, keeping a supply chain that is very strung out has a lot of risk. And I think there will be a lot of discussion about supply chain risk. And that should be a metric that we all start to measure. What is the supply chain risk if you're a hospital? What is your supply chain risk if you're a manufacturer? What's your supply chain risk, if you're a not just a manufacturer, but let's say you're a service company? Where does it exist? Where is that risk, and how do we quantify that, and then come up with something that's acceptable? I wouldn't be surprised if this does not become a common board discussion now, real review. And based upon that, we would expect a couple things to happen. Number one, we'll expect our supply chains to become much less global and more local. Number one.
Yeah, and we may include things that we tried to get rid of, like warehouses. I mean, the whole thing is that, the CPAs won the game, and we got rid of all the warehouses, and everything was just in time. Well, like you said, all it takes is one of the weakest links in the chain to be broken, and your supply chain's broken, and just in time doesn't work anymore. So I think we may see an emphasis on warehousing things a little bit more.
And I think the second thing is everything is going to be digital now. I mean, a lot of things that weren't digital before, that we had a lot of interaction on a personal basis, will now move to the digital environment. I mean, take a look at what's happening with retail. I mean, a lot of retail is now going to close, and a lot of the retail that is going to go online. That anything that's even slightly questionable is going to move online. That's going to have.
We're already talking about Ed. We're already talking about drivers. Okay, seems like we moved to the topic which I wanted to ask you about. Where do you see the kind of light, at the end of this tunnel in terms of that economy has not stopped? Okay, people looking for solutions, people creating solutions right now, and it will only grow, right? Can you please comment on what you think is going to ahead of us in the way of digitalization of business, in the way of new kind of economy growth spots?
Well, I think we're seeing it already. I think the rise of Zoom now, and a lot of classrooms moving to being online, we're starting to see anything that needed people that gathered in a space will be changed.
Telemedicine is huge already.
Telemedicine.
Yep.
Right now, for instance, a lot of people who have children don't want to walk into pediatric clinics because they believe that's where sick people are. And of course it is. It's a chance to, again, a risk of catching the disease. So now they're all in the parking lots and having drive-through pediatric visits, which tells us that telemedicine now will probably come to the forefront with the FDA and the CMS, the Center for Medicare and Medicaid Services, starting to approve reimbursements. Also, I would expect a lot of testing now that, that anything that can be accurate, with your iPhone or any other kind of digital device, you can test. I think that will be coming much more to the forefront. So again, that will bring with it the same issues of models. All of those are based on models. All of that will be based on how accurate and precise are the models. Also, this whole issue then will drive algorithmic transparency. For us to have trust in those models, we're going to have to know what they're saying and how they're being built. I mean, for instance, are we going to trust a model that was built in China versus a model built in the US? I mean, we may have different values of how that model or the rules in that model represent the outcome we're looking for. So this will be a huge growth in the area of digitization and all those other parts that go with it, from accuracy to oversight, to overall transparency, everything we need to do to embrace that into the new environment. So the world we came from 2 months ago isn't going to be the world we're going to be in the next 3 to 6 months.
What I'm hearing you say, Ed, is this is going to supercharge the digital transformation.
Yep.
Absolutely. I mean, we now, it's no longer something you might want to do. It's something you're going to need to do to be able to move forward with your business.
No longer optional. And speaking of jobs, actually, even in the area that you mentioned, and there's so many others that you have not mentioned, right? In all these areas, this growth, these investments, okay, Zoom is giving me this warning. So the growth, these investments, okay, it's gonna flourish, and we would need tons of people with the skills to able to drive this new economy. So I think this is a great, great driver for education in certain areas. Great way to transform a lot of educational institutions to start preparing those people. Okay, and colleges, universities, community colleges will rethink. I'm sure they will rethink and target this kind of need and demand in the marketplace. Absolutely. Don't you think?
In every disaster are the seeds of opportunity.
Absolutely, and absolutely. These ones are clear. Yep.
Ancient wisdom, Chinese wisdom. You know, that's very true here. Every one of these has the chance to birth something new, and that's the bright side that we can look at when we finally get through this, is what are those new opportunities and how do we take advantage of them? I mean, if any country can do that, it's the United States.
It's this country,
we have,
for sure. Yep.
This country, we have the free market, we have the ability and the tenacity to get ourselves up from any knockdown situation, as we've done with Pearl Harbor, as we did with 9/11. We have the resiliency in our people to pick up and make this happen. And a lot of people criticize the millennials, but I'll tell you right now, this can become their finest hour.
Yeah, I think it's going to require a new set of skills and capabilities that is going to rewrite, you know, a lot of things. And that may cause problems for older generations. I mean, I have a 95-year-old mother. I don't think she's going to be able to thrive in this new kind of economy. But I think you're right. The millennials are used to this kind of economy. They're used to socializing electronically. You know, it's no big deal for them, and they don't mind. I mean, you know, we have a daughter that she has a very responsible job. She doesn't shop anywhere. I mean, everything's delivered to her house, food, everything. And in fact, some of it's pre-made, some of it's not. So they've learned how to optimize their time. I think we can learn from them.
Absolutely. I think, again, this is their time. And they're the ones at the right time in our country to lead us and help us drive into the new situation that we're going to face.
Fantastic, fantastic. Okay, fabulous session. I've learned so much. So let's keep working. Let's keep doing what we do, right, in our respective places. Let's reconvene. How about few weeks in? Because this is amazing how fast situation changes. Cannot wait to see good news. We're all kind of hungry for that one. At the same time, let's keep working. Let's keep doing what we're doing.
Okay.
All right. Thank you. Thank you so very much. This was great. Thanks a lot.
Fun session.
Was it controversial and opinionated enough?
This is opinionated, so keep growing your opinions, keep growing your observations, and most importantly, your optimism, because it's definitely a lot of things we would need to be doing, right, in the years to come. So this is fantastic. And again, thanks so much. I'll talk to you soon.
Thank you. Thanks, Jim. Good job.
Here, yeah.